I'm Marc Gillinov, the chair of cardiac surgery, of heart surgery here at Cleveland Clinic, and I am just out of the operating room to talk with a friend, a patient, a music professor and savant, Mr. Rick Beato. And at the time that I operated on Rick and fixed his mitral valve, I had no idea how prolific and important and beloved you are in the world of music. Everyone I operate on is a person who has a life, but at the time, I'm sometimes so focused on this little thing, your mitral valve,
Right.
which is only this big, and that mitral valve was leaking. You're the first music professor I have ever met. But tell me, how did you find out, as someone who you felt good, right? And you found out, oh my gosh, I need heart surgery. How'd that happen?
I was in a routine physical about 8 years ago, and my doctor's listening and just, It's like, what? And he said, that sounds strange. You have a heart murmur. I said, what is that? He said, it sounds like you have a leaky valve. So I watched it for years and years. After 5 years, he said, you might need surgery in 3 to 5 years. And then finally, back last April, I had a heart MRI, and they said, you definitely need to have surgery.
But at this time, you're still
felt fine.
No symptoms.
Well, I mean, I was tired in the afternoons, but I thought, at the time I was 61. I'm 61. I just turned 62. Maybe I'm just tired in the afternoons. But since I had the surgery, my energy level is back to normal. When I went into the surgery, I didn't realize how many people are involved in these procedures, Dr. Gillinov.
There's only one star. That's you. That is the person that we've all gathered around to do the plumbing, get things fixed up. But everyone is super specialized. You've got cardiac anesthesiologists and a cardiac nurse anesthetist. You've got 1 or 2 people who run the heart-lung machine who are called perfusionists. And then you have 2 surgical assistants who only do cardiac surgery, and 3 nurses who only do cardiac surgery. And the great thing about our setup is all of these people are only with cardiac surgery. Most of the time, the mitral valve and the aortic valve and all the heart valves, they're sort of pliable. They're like skin.
Okay.
And you can work with that. If I got a cut on my hand, I could stretch it and close that. So if we cut a little piece out, it is pretty easy to bring it together. Or each part of the valve, the mitral valve, each part's like a parachute. So if you think of a parachute with a canopy, and then there are these struts,
Yep.
If one of those struts broke, someone's floating down on a parachute, a strut breaks, then the canopy, which is like the valve, flails in the breeze. Yeah. And that happens to the mitral valve.
That's what happened with me.
Exactly.
Yeah.
And it's not a big disaster like the guy with the parachute, because you've got about 20 or 30 of them. These days, somebody with a valve that leaks like yours, we would say 99% chance of repairing it. This is like a car that's been in a fender bender. We don't need a new car. Right. We should be able to tune this thing up.
And how long after the surgery is the heart pretty much back to where it was?
And someone like you who starts with a normal heart, the minute we're done.
Right. When somebody asks me if I have heart disease, I say no, but I had my mitral valve repaired.
Yeah, that's the correct answer.
Once it healed, I literally can't tell anything unless I see my scar. I really can't see anything that happened. And the scar is really starting to fade now too. I was back working a week later. I was making videos and I felt great.
That's remarkable. I remember seeing video of you on YouTube at a week after, and you looked way better that day than I did that day.
I exercise every day. I can sprint. I can do everything that I really couldn't do. That's probably the first time that my heart had worked properly in years.
Or what I would tell everyone is, if you haven't had someone listen to your heart in the last year, put that on your list for tomorrow. Because you can pick this up before anything bad happens. Now I'm a follower on YouTube. I mean, it's really, really good.
Yeah, I'm very, very grateful, Dr. Gillinov.